Greetings from Asthma, Chest and Allergy Center, New Delhi. I am Dr. Vikram Jaggi, and today I will be talking to you about a very common allergic condition called allergic rhinitis. This is in fact the most common allergic disease in humans. Allergic rhinitis, sneezing, watering, runny nose, blocked nose, throat irritation. This is what happens to patients of allergic rhinitis. To get a sense of what happens in allergic rhinitis, just try to imagine what happens to you when you get a flu, a common cold or a viral infection, which everybody has 2 or 3 times in a year. During that period, you will have all of these symptoms. You need to keep a towel under your nose, you are sneezing, coughing, wheezing, headache, etc., watering of the eyes. This fortunately lasts only 3 to 5 days in a viral. But in allergic rhinitis, this goes on and on and on. If it is a seasonal allergic rhinitis, then like clockwork, come September, come March, April, the patient will suffer for 2 months or so. And in those patients who have perennial allergic rhinitis, which means year-long symptoms, this goes on and on every day. All 365 days of the year, this goes on and on. To show you what happens to these patients, how much their suffering is, I am going to show you a very short video. Take a look at this. Incessant, non-stop sneezing. And you can see the agony and suffering of this patient. These patients of allergic rhinitis suffer. Their suffering is on many fronts. It's of course not a life-threatening disease, but their performance in school, their performance at work suffers. They cannot concentrate. Students we have seen who have allergic rhinitis, and when they have major symptoms, their performance in grades goes down. They have to take leave from school or from office. Moreover, nobody gives them any sympathy. Neither the doctors nor the patient's relatives. After all, it's only sneezing. What is the big deal in this? That is the common refrain. But it's only the patient who know how much they are suffering. And sometimes the patients also have adjusted to that. They have become accustomed to that. They don't even feel confident that something can be done, which is not true. A lot can be done. In some recent studies, it has been shown that the quality of life and the impact on quality of life of allergic rhinitis, diabetes and heart disease is almost similar. So what is allergic rhinitis? It's an allergy of the nose where the nose is oversensitive. Something goes inside which are allergens, which causes inflammation and then triggers make the problem more severe. The allergens are house dust, cat, dog, certain foods, and pollens of weeds and trees, etc. Fungal spores. They cause an allergy and triggers like strong smells, tadka, paint, polish, perfume, sudden changes of body temperature, getting up in the morning, after a bath, after playing, etc. Emotional upsets, laughing, crying in women after menstrual cycle. So these act as triggers and cause more problem, and the symptoms are by and large only 4. Sneezing, running nose or watering of the nose, blockage in the nose, and itching in the nose. As a consequence of that, these patients keep doing this. They keep moving their nose, they do all of that. The people who are around them think that these are tics. What is this person doing? But actually, the person cannot help it. It's not a tic, it's an allergy. And the patient is trying in vain to clear the inflammation over there. So this is what happens in allergic rhinitis. As a consequence of that, constantly doing like that, children will develop a crease over here, a fold over here, dark circles under the eyes, headache, frequent ear infections, frequent throat infections. These are common consequences of allergic rhinitis. Recognizing this is not difficult. Typical history, doing a few blood tests, nasal smear tests, one can make a diagnosis of allergic rhinitis. Then the question is, what is this patient allergic to? That can be done by doing a skin prick test, wherein on the skin, either on the forearm or on the back, various allergens are pricked with a very tiny needle. It's almost painless. And then the reactions of those things are seen, so then we get to know exactly what you are allergic to, and then you can avoid those things. How to manage this condition? Please note, I am not saying how to cure this condition. It cannot be cured. This is a disease which is inherent in your body. So it can be controlled. It can't be cured usually. Children sometimes outgrow their nasal allergy, quite frequently actually. So how can we manage or control this? Just like we control any chronic disease, let it be diabetes. How do you control diabetes? Through knowledge, through precautions, and through medicines. Similarly, allergic rhinitis is also controlled through knowledge, avoidance, and medicines. And in the case of allergic rhinitis, we have another fourth thing, which is immunotherapy or allergy vaccination. So let's talk individually about each of them. Knowledge. The patient has to be willing to understand what is this condition, how does it happen, what are the triggers, what are the allergens, how you should be able to avoid them, what is the correct way of taking medication. For example, the medicine is to be taken in the nose. Put this in the nostril, point it towards the outer wall of the nose and squirt it. Point it in the outer, squirt it inside the nose, of course, like this, and that's all. No need to make postures, no need to do this. It's very simple. So these are some of the things the patient has to acquire knowledge about. Number 2, avoidance. Once we have found out what you are allergic to, you have to avoid those things. In terms of food, it is simple, but food is not a major cause of nasal allergy. Pollens, fungal spores, dust, etc. You can try, but sometimes avoidance is not possible. For example, in pollens. So we have to take the help of medicines. When we are thinking of using medicines for a longish period of time, safety is of paramount importance. So medicines for these things are safe, they are effective, they control the symptoms, they don't cure the symptoms. What are the medicines available to us? The most commonly used are antihistaminics. Histamine is released in the nose in allergy, and antihistaminics are used to control that problem. These can be taken by mouth or they can be taken through into the nose itself. Spraying it into the nose is obviously better. The medicine is just going to the right place and not going anywhere else. There are no side effects. Even the oral antihistaminics nowadays are very safe and are devoid of the common side effect, which was sedation, neend aana. So these are some of the medications which are antihistaminics. There is another medicine called Montelukast, which is good for controlling allergic rhinitis, asthma, and for skin allergies. Lastly, inhaled corticosteroids for the nose. These are clearly the most effective anti-allergy medicine for the nose. And fortunately, when we put them in the nose itself, they are very safe. They control all the 4 symptoms of allergic rhinitis, including blockage, which through other medicines is not easy to control. They take time for them to start working. So don't become impatient if you use them for 2 days and not much improvement is there, because they are controllers. They will take some time to act. 2 weeks is very usual. Once they start working and your nose is feeling very nice, very normal, one can reduce the dose with the concurrence of the doctor, but don't be in too much of a hurry to stop the medication. So this is in brief the role of medicines for allergic rhinitis. And I mentioned a 4th therapy also, which is allergen immunotherapy, which is a very good therapy for, these are allergy vaccines. Suppose a person is allergic to house dust and a pollen, say Parthenium, Congress grass. Now you can't avoid them. This you can avoid a little bit, this you can't avoid at all. So a vaccine is made with that same very thing in dilute dose, moderate dose, and higher dose, and those are given under the skin as an injection weekly, fortnightly, monthly. So that slowly the body becomes tolerant to that, immune tolerance develops, so that those things can now go inside and not cause a problem. This is the only modern allopathic therapy which can cure allergic rhinitis and cure allergy. It's not expensive. It's not a drug, so no side effects that way. But so many injections are also not easy, and it doesn't help everybody equally. On proper vaccination in allergic rhinitis, around 70% of the patients will get very good relief, 20-30% will get some relief, not very good, and 10% might not get much relief through this therapy. But a common sensible approach of knowing your allergens, accepting you have this disease, avoiding the things you can avoid, cautiously taking medication, with all these things and with immunotherapy, 95% or more of allergic rhinitis patients can have absolutely normal life. With that positive note, I like to thank you for a patient listening.